Hello, my name is Dr. Kiva Hartley and I'm the clinical lead of the Complex Menopause Clinic here in the Rotunda Hospital. For World Menopause Day this year, we decided that we would try and tackle some of the more common questions that we meet all the time in our clinic. And one of the most common questions I get asked is about the impact of HRT, or hormone replacement therapy, on the risk of developing breast cancer. We know that women with low underlying risk of breast cancer will typically get a greater benefit, a symptomatic benefit than risk when it comes to breast cancer if they take HRT for less than 5 years. For women who are at higher risk because of a family history of breast cancer, for example, they can still have HRT, but this is a decision that we make with the patient on an individual basis to decide if they will get more benefit than risk from taking HRT. Not all hormone therapy is the same. Typically, HRT is a combination of two hormones, estrogen, which is the bit that makes you feel better, and progestogen to protect the lining of the womb. Women who've had a hysterectomy often take estrogen on its own. This form of HRT is associated with a lower risk of developing breast cancer. And it's in some of the studies, in fact, has been shown to have a small reduction in risk of developing breast cancer. The majority of women will take combination hormone therapy because they still have a womb and they need to take their progestin to protect them from thickening of the lining of their womb. Combination HRT does carry a small increased risk of developing breast cancer. It is related to the type of progestin that we're giving you to protect your womb, and it is also related to the duration of use, how long you take your HRT for. Different studies have shown different numbers, but we tend to tell patients here that if they take HRT for 5 years and they start their hormone therapy in their 50s, we would see 4 to 8 additional breast cancers per 1,000 women taking HRT for 5 years. This compares to things like drinking a bottle of wine a week, being inactive, and other lifestyle choices that we make, and would be comparable to these different lifestyle choices in terms of their impact on breast cancer risk. We do see benefit from hormone therapy, like a reduction in osteoporosis and improvement in bone density, a small reduction in cardiovascular risk, and often those benefits can outweigh the risk of developing breast cancer from HRT, particularly if you're taking it for 5 years or less.